welcome everyone to Plant-Based Kidney Health. As always, I'm Dr. Sean Hashmi. My partner is here, Michele Crosmer. You guys know us. We're the MDRD twinsies. I've been joking around. I have to tell you, Michele, I've been joking around with my daughter lately. I call her my twinsy because my wife says that she behaves just like me, and that's so scary. It's so scary.
Twinsies,
but she has all my bad habits. Yeah.
Hopefully your good habits too.
She has the good habits too, but it's the bad ones that are like, it just scares you, right? You're like, oh my God. So
they're the ones that stand out right now.
Yeah. So before we get started, Michele, I wanted to make a complaint, and this is a really important complaint. So I went to Costco, and sometimes when I'm really tired and lazy, and I'm just like really stressed out, I get like these prepackaged stuff. So they have these lentils that are prepackaged. It's great in terms of health, but the other part of health is not so great. It has so much salt. I don't know why the heck it does, right? So if you took a full bag of it, you would get like 1,000 milligrams of sodium in just that one thing. So I'm trying to get one serving out of it. And they say one serving is 2/3 cup. Now, I'm like, I have no idea, because you put the whole thing in the microwave, you warm it up for a minute, and then you pour it out. But I got my little bowl there, and I have my little bit of brown rice, and I'm like, what's 2/3 of a cup? Because I don't want that much salt. So that's my complaint about Costco. If they're listening, please make it easier for people like me. Put a mark on the bag or something.
That's a good idea, putting a mark on the bag, or get a 2/3 cup measuring cup, and then you can measure it out. But which, of course, all dietitians have that, but not everyone else. But Trader Joe's has, for anyone who does have Trader Joe's, they have steamed lentils, it's like a vacuum packed package. And I think what it is, for the serving size is a half a cup, but it's around 230 milligrams of sodium for that amount. So not even close to as high as the Costco one. And I think you get a couple servings in the package. And what I normally do if I get that is it's all vacuum packed, and I'll basically break it up into a bowl. And then I get my half cup measuring cup out, just, okay, I'm going to measure this portion. And it's already cooked. You could eat it cold. You could heat it up. You could throw it into a stir fry or something, but it is lower in sodium, at least than that one.
Got it. I'll put it on my Christmas list. By the end of this year, I will have a measuring cup.
I'll get you one.
That's on my to-do, yes. There you go.
Oh, well, today we are another really big topic where, again, there's lots of myths and confusion and miscommunications around it. But we're talking about potassium today. And again, this will also be broken into multiple episodes because we have a lot to talk about. There's a lot to explain. And then we have tons of questions that we get. So don't worry if you've submitted something and we haven't gotten to it yet. You can still submit your questions to plantbasedkidneyhealth@gmail.com because we will add them, we'll answer them, and especially around something as confusing as potassium is.
Excellent. So where do you want to start on this really huge topic?
Yeah, let's start with just simply, what is potassium and what is its, importance and relationship to kidney disease and kidney health?
Yeah, so potassium is a huge topic, and it's so important. When we were talking about high FOS, we said, high FOS, so forth and so on, these are the treatments. Higher phosphorus is forgiving in the sense that over time, it does a lot of damage, but in the immediate term, it's okay. But potassium is absolutely critical. So first, potassium is an electrolyte, right? It has a lot of functions. The main function, which by the way, a lot of people don't really realize, is its job is to maintain fluid levels inside your cells. So remember, salt or sodium, its job is to maintain fluid levels outside of cells. So that's where people are like, yeah, really? Potassium does that? Yes. Now, the other stuff potassium does that's really helpful is it's important muscle contractions, right? So if I had a gun show here and I'm trying to contract my muscles, well, that's exactly, by the way, my daughter and I, we have this thing about gun shows. So she's like 4, right? And so she works out with me in the morning. She's like, Daddy, look at my muscles. So every morning I get a free gun show, and it's really, really awesome and cute. So muscle contraction is one of it. And then the other thing is it's really important in supporting blood pressure, meaning keeping your blood pressure in a healthy level. Now, here's where it gets really fascinating, and people like myself who We like to call ourselves nephrons because it sounds really cool. It's not that cool, right? But when you look at potassium inside your blood has a concentration about 3.5 all the way up to 5 milliequivalents per liter. So 3.5 to 5, remember that number. But now let's look at the concentration of potassium inside cells. It's about 140. And why should you care? Because if potassium, which in your blood is about 3.5 to 5, if it goes up to about 5.5 or above, you start to have all of these things happen in your heart. So imagine if some of those cells that have 140 milliequivalents per liter start to break apart. That can have devastating effects on your body. So as you think about that, realize how amazing your body is, that your kidneys work so well, that you're constantly flowing potassium back and forth between your blood and your cells going on. Now, one thing that's important to understand is that what the data shows is if you eat a diet that's rich in potassium going on, you can actually lower your blood pressure naturally by about anywhere between 3.5 to a little bit over 7 points. And you can reduce your risk of strokes by as much as 24%. This is simply by adding more potassium to your diet. How? With everything, Michele, that you talk about, which is eating lots of fruits, lots of vegetables, which come naturally in potassium. So you don't have to do anything fancy going on. And overall, people who have diets that are rich in potassium, they actually have a substantially lower risk of developing cardiovascular disease. In one study, in a meta-analysis that was done in 2021, what they showed was that people who are having over 1,000 milligrams of potassium excretion in the urine, which means that you're taking more potassium than you need, so you're excreting more potassium to keep that balance. But what they were finding was that those folks had an 18% lower risk of developing cardiovascular disease. So potassium is amazing in terms of what it does. But high potassium is stuff that you do need to worry about because the symptoms are life-threatening. So let me repeat, high potassium is life-threatening. So when your kidney doctor, when your nurse, when anybody in your healthcare team calls you and says, Mrs. Jones, your potassium is very high and we need to act on it, you must act on it because it can cause muscle weakness, substantial muscle weakness. It can cause paralysis. It can cause fatal arrhythmias, meaning your heart goes onto rhythms like ventricular tachycardia, which in order to break it, we have to shock you. It can go into ventricular fibrillation, where instead of squeezing, the bottom of the heart is doing this number, where it's just fibrillating, meaning blood isn't getting to the organ, so all your body is starving, or your heart can stop altogether. The net consequence of all of these things from hyperkalemia is death. So when I teach medical students or residents or fellows, what I tell them is the first symptom of hyperkalemia. The first symptom of hyperkalemia is death. If you wait for symptoms, you are going to be absolutely too late. Now, why does this matter to chronic kidney disease patients? Because more than half of patients who have chronic kidney disease, they will go on to develop hyperkalemia at one point in time or another. And the biggest causes of it is as your GFR goes down, your ability of your kidneys to get rid of that potassium goes down. As a result, excess potassium starts to build in the diet. So the main thing that really contributes to high potassium is really a high potassium diet. There are other things, right? So things, for example, is tissue breakdown or muscle breakdown. Let's say you go run a marathon. You're going to break down a bunch of muscle, and as a result, you're going to release potassium. But if you have normal kidney function, those kind of things are much rarer. Or if you're in, God forbid, in a car accident and there's a crush injury, all those cells break. Remember, the concentration was 140 inside those cells, so all that potassium gets released, and it comes into the blood. But once again, rare. But when it comes to diet, that's the biggest thing. Now, we're going to talk all about medications and stuff in a different episodes, but medications like ACE inhibitors, ARBs, aldosterone antagonists, so things like lisinopril, benazepril, losartan, spironolactone, these are all things that can increase your potassium. And of course, other stuff is if you develop acidosis. What's acidosis? It's where the acid in your blood starts to increase. Now, when that happens, potassium from inside your cells will move to outside of your cells and end up in the blood. And for all of the science people who are there is, but there are exceptions to metabolic acidosis. Yes, there are. Lactic acidosis, ketoacidosis, you don't develop hyperkalemia. But that's beyond the scope of this. If you have acid in the blood, and with kidney disease, your doctor may say, Mrs. Jones, your bicarb or your bicarbonate level or your base level is too low. I'm going to give you some baking soda pills. Right? The reason they do that is because that acid starts to leach away the calcium out of the bones, the phosphorus out of the bones, starting to break down the bones. It's putting stress on all of your organs going on. And by the way, if you're thinking that you have more acid, one of the easiest things is add lemons and limes to your diet. Everything you eat, add lemons and limes to it, and you can do the same thing as the sodium bicarbonate pill will do without the sodium component of it. Now, other things to remember about this whole issue that happens with hyperkalemia is if you're somebody who is a diabetic and you have essentially a situation where your sugars are becoming very, very high and you don't have enough insulin, especially if you're a type 1 diabetic, insulin deficiency can also shift potassium from the cells into the blood. The bottom line with hyperkalemia, the thing that I want you guys to take home is it is very, very, very serious. And please do not ignore it. If you have it and you think, well, I've always run a K of 6 and nothing has happened and therefore I'm okay. Your body does not get used to high potassium levels. It's not like all of a sudden your heart is going to get used to it and you're not going to have an arrhythmia anymore because you've had it for a year now. That's not how the body works. So this is something that we have to emphasize. If you have it, you must talk to your healthcare team. Now, the flip side...
Sorry, I just have a question on that with the high potassium or hyperkalemia. But is there a certain GFR that you see where it becomes more of a concern with high blood potassium levels?
Yeah, so generally speaking, as you start to go into stage 4 and stage 5. So remember, when we start to define stage 4 is when your GFR starts to drop below 30. That's where you know that hyperkalemia is a lot more sensitive. So we as nephrologists, when we prescribe medications, the reason we ask you is go ahead and do a blood test for us in 7 to 10 days after we start, or change the dose of a medication is because we're more concerned. But it's a misnomer to think that just because you're stage 3, you won't develop it. Hyperkalemia is just overloading your body's ability to maintain that balance. That's all it is. And that can happen very, very easily. So even if you're stage 3 and you're on certain medications, we still want to make sure that your potassium stays in the normal range.
Okay, thank you.
And once again, you do not get used to hyperkalemia. Your body will not get used to having high potassium levels. So you got to know this, because a lot of patients come back to me and say, oh yeah, it's no big deal. I always get called every week from my doctor because my potassium is 6.5 and I don't do anything about it. I can tell you, having done this for so long now, I have seen so many bad things happen because the patient purposely chose not to take action on it. Now, let's flip the equation a little bit. Let's go to hypokalemia, which means low potassium. So low potassium can happen for a number of causes, but the biggest one is if you lose potassium through your gut, meaning the GI tract. And the most common reason is you got diarrhea. So people who have significant diarrhea, they can have it. The other way that happens is something called renal tubular acidosis, or an RTA, but essentially the kidney is losing potassium. Instead of trying to hold on to it, it's losing. How do we check? Same thing. By measuring the urine that's coming out, we can look at the potassium and calculate the excretion and know that if it's excreting too much potassium and you have low potassium in the blood, the kidney's not doing its job. It must be the kidneys, right? And if that's not the case, it means it's coming from the GI tract. So what are the symptoms of hypokalemia? Well, the first thing you got to know is just like hyperkalemia, hypokalemia can be very, very dangerous as well. So it also causes weakness. It can also cause muscle breakdown, or what we call rhabdomyolysis, which is your tissues and muscles starting to break down and releasing all of the stuff inside them. It can slow down your heart, cause bradycardia. It can cause the opposite, or speed up your heart with a rhythm that we have to shock you for, called ventricular tachycardia, or the worst one yet, which is fibrillation, where the heart fibrillates instead of squeezes. And knowing all of those are things that can occur right away. But what's interesting and scary about hypokalemia is if you leave hypokalemia alone, meaning you don't do anything about it for a long time, it can actually cause some very serious stuff to occur. So for example, people can find that their ability to, neurologically, their ability to concentrate actually starts to go down. And one of the things is their potassium is low. And if you correct that, they find, wow, things are getting better again. They also find that they may have issues where the kidney itself starts to have an issue with concentrating. And so when that happens, is its ability to be able to hold on to urine goes away, and it starts to have so much urine coming out that people can get dehydrated going on. And that's a big deal. Some people, interestingly enough, when they have low potassium, they start to see high blood pressure. Remember, the data shows if you raise your potassium in your body, the blood pressure comes down. The opposite has the same effect. And then the last thing that you want to remember is that there are certain things where you start to spill more protein in the urine simply because your potassium is low. Now, those are the things that we talk about, high and low potassium, but that's not where the story ends. There are two more things that you got to know. First one is there's also a fake high potassium and there's a fake low potassium. And you got to know this because oftentimes when we get a blood sample and it's high potassium, we want to know, is it pseudohyperkalemia or fake high potassium? And how does that happen? The most common is during the blood draw. If there's a lot of trauma, if they left the tourniquet on when they were actually trying to go into the vein, that would cause it. So as soon as you get the needle in the vein, you want to take the tourniquet off. If you leave it on and the needle is in and you're drawing the blood, you can actually cause the cells to break apart. And remember, inside the cells is a massive increase in concentration going on. Other thing that can do it is exercise. If you exercise right before you have your blood drawn, it will cause more potassium to come out of cells. But you know what's even simpler than that? Is a lot of patients I see, they clench their fist before getting their blood drawn because they might have small veins. Repeatedly clenching your fist will do what? It can actually cause exactly the same thing, which is increase the potassium concentration, release more potassium out of the cell so that tube can look like it has an increase by as much as 1 to 2 milliequivalents. Oh. So if you were 4, you might be 6.
So can you tell that on, does the person who's drawing the blood, can they tell that, or you see that on the report when it comes back, or you just don't know? You don't know. And this is why these things are so important, right? So knowing that you can't leave the tourniquet on too long, knowing that repeated clenching is an issue, knowing that you don't want to exercise before, and then of course, when they draw the tube, nowadays this is not an issue, but back in the day, if you were to leave the tube alone and let the blood kind of sit there and it clots up and everything, the cells in there would break, and as they would break, they would start to release potassium going on. So what happens is as you draw the blood, the platelets that are in there, in that blood, they will actually break apart and release the potassium inside them. So people who might have a condition called thrombocytosis, where they have a lot of extra platelets, you can actually see this going on. Same thing is if you have a lot of white blood cells. Let's say that you have a type of leukemia called chronic lymphocytic leukemia. When you get that blood drawn, those white blood cells are so much and they're so fragile that taking it out through the needle, they start to break. So
If you're somebody who always has normal potassium and all of a sudden you have high potassium and you're like, there's no way, I didn't do anything different, I listened to everything Michele said, and why the heck do I have high potassium? It must be Michele's fault. No, it's not Michele's fault. And when in doubt, what we recommend is, let's just do another potassium. And as an informed patient, when you go in, remember, don't go crazy with the clenching. Don't leave the tourniquet on too long. Once the needle is in, take the tourniquet off. Okay, so that's the fake high potassium. Let's do the fake low potassium. So what can do that? So in terms of fake low potassium going on is other conditions. So for example, people who have AML or acute myeloid leukemia going on, what happens there is those cells, they're so rapidly moving and trying to suck everything in that after you draw the blood, they can suck in all of the potassium and make it seem like you have low potassium when you actually don't. So it's the opposite effect. Same thing if I gave you too much insulin, all of a sudden it would drive the potassium into cells, make it look like you have low potassium, but really I just drove it into cells. If I gave you too much bicarbonate, it would do exactly the same thing going on. And of course, if I gave you a type of medication that's called a beta agonist, that would make your heart speed up like crazy, and it would also drive the potassium into cells. So now you have 4 types of potassium issues: hyper, hypo, pseudohyper, and pseudohypo. That's a lot to learn today.
So with those 4 types, regardless of whether someone is, if they're normal, usually have normal potassium and all of a sudden it's really low or it's high, or someone at any point has a high or low value, when should they have a lab draw repeat done? Is it 7 days? Is it 10? Is it a couple months? When should that be checked again?
Yeah, so this is really key is if they have high potassium, I want to make sure that their potassium is in a better, safer place. So we're going to talk about the treatments of high potassium in a different episode, but once we do the treatments for high potassium, we go ahead and repeat that in a couple of days. If it's super high, I'll repeat it the next day just because from first do no harm, I need to make sure that they're a safe place, that when they go to bed at night, I feel safe, that I have done everything I can to protect them. So it's not one size fits all, but it's really about making sure that they're stable. And it depends on what treatment you're using. So if it's something like one of the GI treatments where it's going to cause you to excrete it out, right, that's going to take about 6+ hours to work. And so at a minimum, I need to wait that much to see the effect going on. If it's other things like the IV treatments, such as the insulin going on, right, such as the beta agonist going on, those kind of things, those are immediate and they last only 15 to 30 minutes.
Okay.
And then they're gone.
Interesting. And for people who are always in the normal range, they're between 3.5 and 5, if they see, is it fine as long as they're within that range? Or what if they go from 3.6 up to 4.9? Is that big jump concerning, or is it okay? Like, can people move around a lot within that normal range?
Yeah, so people move around all the time. In fact, if I was to take, let's say I took your blood 3 times today, I guarantee you I would get 3 different values. And if it was in the morning after you'd worked out or done everything versus you just woke up from sleeping, you could change the values so significantly. So in terms of that, no issue going on. But the thing is when it goes higher than 5.5, that's where all of these issues of arrhythmias come in. Because the thing that we worry about with high and low potassium is death, and death.
Got it. Okay. And so, and knowing then the importance of all this, and this is something that I think comes up a lot is, let's say someone does have high blood potassium levels, or they trend on the higher end and they are following a lower potassium diet. Is it that, and I get asked this a lot, is it that the high potassium foods, or if they're eating a high potassium diet, is causing their kidney disease to accelerate more quickly and damaging the kidney? Or is it that it's simply causing the side effect of hyperkalemia, which needs obviously to be addressed? or both?
Yeah, so in this, normally we say it's like a chicken and egg thing. This is not a chicken and egg thing. High potassium is not damaging the kidneys. It's the fact that the kidneys can't regulate the potassium enough, and that's why the potassium is building up. So as the kidneys lose their kidney cells, they just can't get rid of it. But high potassium is not directly damaging the kidneys. Now, if high potassium causes an arrhythmia in the heart and you don't send enough blood flow to the kidney, that's a whole other story. But no, it's not high potassium leading to kidney disease. It's kidney disease leading to high potassium.
Got it. So then someone who has normal blood potassium levels, they're consistently normal. It's not that eating a normal potassium diet or even a higher potassium diet is causing kidney disease to get worse. It's your kidneys are working enough and efficiently and well enough to be able to prevent too low or too high potassium levels.
Right, because remember, so if you guys remember the phosphorus episode we did, in that one we said even if your phosphorus levels are normal, but your CKD is 3 or worse, meaning your GFR is dropping below 60, you still want to make sure that you cut down on high phosphorus foods because of all of the secondary things it's doing and because other organs are compensating. But with potassium, remember, as long as you're in the safe range, you want to eat a high potassium diet because of all of the benefits on things like stroke, on things like heart disease, on things like blood pressure going on. So it's totally different. So don't let the phosphorus and potassium story confuse you. As long as your potassium levels are okay, there is no reason to restrict fruits and veggies out of your diet.
Perfect. Thank you for saying that. And I think that is one of the biggest myths and misconceptions. And it's not downplaying how important it is to address high potassium blood levels, but in people, and like you said, at least half the people with kidney disease have normal blood potassium levels. And that's where it really needs to be individualized based on your labs and knowing your labs, because you don't want to be restricting potassium or overly restricting it if you don't need to, because there's a lot of benefits of these potassium rich foods in your diet.
Yep, absolutely. So let's go a little bit further. Michele, what would you say, when we talk about a low potassium or high potassium diet in terms of specifics, so, milligrams per day or milligrams per week, and really same question that we had talked about with phosphorus is, how do I sort of know how much I'm getting for potassium?
Yep. Great question. So, there's definitely ranges for everything, but in general, so let's start with what is recommended for the general population. So the RDA for potassium for the general population is around 4,700 milligrams of potassium a day. Now, most people don't eat that much potassium. I think it's something like 2,500 to 3,000 milligrams of potassium a day is what the general population consumes. So it's much less than what that recommended amount is. Now, when we get into kidney disease, someone who needs a low potassium diet or needs to restrict the potassium in their diet, typically that's around 2,000 milligrams of potassium a day. So it's significantly lower than what the RDA is. And it might be, maybe it's 2,000, maybe it's 2,300, maybe it's, 1,800 milligrams. We don't eat the same exact foods every day, so we're not necessarily having the same amount of milligrams, but a low potassium diet's usually around 2,000 milligrams a day. Now, it's important to remember that that's low potassium. It's not no potassium. And even if someone is on a low potassium diet, depending if they're having 2 to 3 meals a day, 1 to 2 snacks, their meals could be 500 to maybe 800 milligrams of potassium. Snacks could be 100 to maybe 300 milligrams of potassium. And that's just for a low potassium diet. When we look at a moderate potassium, so maybe they don't have a tight restriction, but they need to be a little careful. That might be anywhere from 2,500 to 3,500 milligrams of potassium a day, somewhere in that range. And then usually what we consider to be high potassium or like no restriction, limitation at all, it's usually over 4,000 milligrams a day. That can vary from person to person, again, depending on medications they're on, depending on, other factors, but that's just in general what you can use as a guideline. And if you're curious how much you're consuming, then you can always track in an application. So something like Chronometer or Chronometer is pretty good at, you can log your food intake for the day and you could see how much potassium you're consuming. And that's really helpful because a lot of the times what I see, at least from if diet is causing someone to have high blood potassium levels, oftentimes they've been consuming these like crazy amounts of very high potassium foods and it's adding up to be a lot. So they might be having like multiple sweet potatoes and avocados and tomatoes and Brussels sprouts and mangoes and guava and all these very, very high potassium foods versus just having, okay, I normally eat low to moderate potassium foods and have a moderate potassium diet. And then if you have half of a banana, right, then it's not this drastic increase in potassium intake. So those are general guidelines and ranges. And again, it's really important to be looking at your blood test results because if you have, especially if you're in an early stage of kidney disease, and especially if you have normal blood potassium levels, if you're trying to, and I unfortunately hear this a lot of like, okay, I diagnosed with kidney disease. I went online and started, Googling what to eat. And now you get all these lists of don't eat all of these, don't eat all these fruits and veggies or don't eat beans or lentils. And so I'm avoiding high potassium foods, but their blood levels are normal. They're consistently normal. All they're really doing is restricting their intake and how much flexibility and variety they have, and also potentially impacting their blood pressure, potentially reducing the amount of fiber they get in their diet at that point. So that's where it's super important. So I would say track, use those guidelines that I said as guidelines. Again, you want your doctor or your renal dietitian, they can give you specifics, but, and then again, remember that we eat in like ranges. And so don't be so like, okay, my dietitian told me to have 2,500 milligrams of potassium a day and I had 2,600. Now I'm all of a sudden my blood levels are going to be elevated. It doesn't work exactly like that. It's if you need around 2,500 milligrams of potassium in your diet a day, you don't want to be consuming 5,000 milligrams or 6,000 milligrams. And again, generally the general population is not consuming that much potassium because they're not eating enough whole plant foods in their diet to begin with.
That's excellent. That's excellent. So folks, I hope you guys learned a lot from today's talk on potassium. This is part 1. We're going to have a part 2 and talk more about some of the specifics on medications and so forth. As always, we really, really appreciate your questions that are coming in because they're helping us to really guide where the show goes. The goal of this show was, Michele and I talked about it, and what we wanted to do was make this a labor of love. We both have our day jobs. This is really about us giving back, and that's what we do here. So please send us the questions, plantbasedkidneyhealth@gmail.com. Michele, any closing remarks?
I think I would just say stay tuned for our next episodes on potassium. We try to keep these episodes not too long. So that's why, trust me, we have a long list of more potassium questions that we will be addressing. But I think a good takeaway is one, knowing what your labs are, knowing what you are eating, and then, making sure that you are working to prevent high blood potassium levels or treat it urgently if they're high. But ultimately, it is individualized based on you and your labs, and you don't want to be restricting when you don't need to. And, hopefully working with your nephrologist and a renal dietitian can help you figure out, okay, how much potassium you need, what sources to get. That way you don't feel overly restricted and deprived in your diet and like you can't eat any of the delicious plant foods that are good for you.
Well, awesome. With that, thank you everybody so much, and we will see you next week. Take care, everyone.
Bye, everyone. See you next week.
Bye, guys.